my name is Sarah. I'm going to be the student nurse that's going to ask you a couple questions today. This is called the audit. This is going to give me a better picture of your drinking habits and what kind of a normal day looks like for you. Is this okay to go through this?
Sure.
Okay. We'll start with number 1. How often do you have a drink containing alcohol?
At least every day.
Every day? Okay. And what is a drink to you?
I mean, I usually just take shots of gin.
Shots of gin? Okay. How many drinks containing alcohol do you have on a typical day?
I mean, recently I'd say at least 6 to 7.
Okay. And how often do you have 6 or more drinks on one occasion?
Probably every day.
Okay. How often during the last year have you found that you were not able to stop drinking once you started?
I mean, after like 6 or 7, I'm able to stop.
Okay. How often during the last year have you failed to do what was normally expected from you because of drinking?
Pretty often, maybe daily, I'd say.
Okay. How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session?
I mean, usually every day, but that's just to clear my hangover.
Okay. How often during the last year have you had a feeling of guilt or remorse after drinking?
Mostly just angry, annoyed, a little bit stressed.
Okay. That's after you drink you feel that way?
Yeah, I mean, when I'm not drinking, I feel that way, so that's why I drink.
Okay. How often during the last year have you been unable to remember what happened the night before because you'd been drinking?
I mean, for the most part, I can remember the nights. I don't get completely blacked out or do anything dumb, but it's just a little fuzzy, I'd say.
Okay. And have you or someone else been injured as a result of your drinking?
I'd say probably, yeah.
Okay. And has that been in the last year?
Yeah.
Okay. Has a relative or friend or a doctor or another healthcare worker been told you about some concerns they have with your drinking?
Yep.
Yeah, okay. Okay. So I'm just going to kind of talk about what I have noticed after doing this assessment. Your drinking is definitely a concern. Having 6 drinks a day is definitely not healthy. It's not healthy for your liver, especially. But it definitely puts you at risk for a lot of things, especially if you're driving. I know you want to get back to work, as you said when you came in earlier, and going to work having 6 or 7 shots in your body is not safe to do, and you probably won't be able to do your job well. So I'm very concerned about that. So let's talk a little bit more about the pros and cons of your drinking. So what are some of the reasons that you drink?
I mean, it relaxes me. It takes away some of my anger. It takes away some of my stress. Usually, if I drink, my wife doesn't like that. So, I just, if I'm trying to avoid talking or communicating with her, I will just drink by myself, alone.
Okay, and let's talk about some of the cons that occur because of your drinking. What would you think are some of the bad things that come as a result?
My hangover.
Definitely.
I mean, so far that's probably the only thing I could list.
What about financially?
I mean, yeah, but I guess I'm doing fine so far, so.
Okay. In the questions that I asked you earlier, you had said that you failed to do what was normally expected of you from your drinking. So do you think that that would maybe be
Yeah.
a con?
Yeah.
What are some of the things that you haven't been able to do because of your drinking?
I'd say I probably skipped work
Yeah.
a decent amount since I've been drinking more. And I don't have kids or anything, so it doesn't really, I don't affect them. The only other person I live with is my wife, but I've missed a couple family outings that I was supposed to attend because of my drinking.
Yeah. Okay. So it sounds like you drink primarily to relax you,
Yeah.
to numb some pain,
Yeah.
but your wife doesn't like it when you drink, and you're not able to function at the level you would be if you weren't drinking. Is that correct?
Yeah, that's correct. I just would be more stressed probably and angry, but I'm pretty good at covering up my stress, so it would just be how I feel internally.
Mm-hmm.
I'd be more relaxed.
Well, as I stated earlier, I'm very concerned about your drinking. I really don't think that's healthy for you. And to get you back on track, I really think that we should try to maybe explore some options of cutting down. Let's see. And as I said earlier, the drinking can have an effect on all of your organs, especially your liver, and could even lead to liver failure or liver cancer, among many, many other things that increased drinking can just put you at a risk for. And we want to try to minimize as many of those risks as possible, right?
Yeah.
Yeah. So, do you think that just cutting back on your drinking, you don't have to stop completely because I know that that's hard, but maybe just cutting back the number of drinks a day, do you think that that's something that you're willing to do?
Yeah, I guess I could give it a try and see how it works out.
Okay. On a scale of 0 to 10, with this little ruler that I have here, 0 is you're not ready to change at all. 10 is you're ready to make the change tomorrow. What would you rate your readiness to change at right now?
I think after talking with you, I would give it probably a solid 7 or 8.
7 or 8?
Yeah.
Okay. What do you think prevents you from being a 9?
I guess I'm just scared because I'm so used to this pattern of me drinking that I kind of forgotten what it's like to not drink, and yeah. I just don't know what to expect. So
yeah, that's very valid feeling that you have, and that's great that you recognize that. So what do you think are some ways that you can cut back?
I guess I could not start my day off drinking. Could start it off and see how far I get before I maybe essentially fall back to it, but don't have that as my first thing in the morning.
Yeah, just trying to eliminate that morning drink to get rid of that hangover. I think that's great, first step. And even if you wanted to maybe try, instead of doing shots of gin, maybe try something with a little less alcoholic content in it, just to give your liver a break a little bit.
Okay.
Does that sound like a plan, maybe?
Yeah, that sounds pretty good.
Okay. Well, how about you go ahead and schedule a follow-up visit with me in, let's say, 2 weeks, and then we can reassess and see how everything is going and see how this new plan is working out for you.
Okay.
Does that sound okay?
Yep.
Alrighty, I'll see you in 2 weeks.
All right, see ya.